For those who don't know me, I'm Dr. Tracy Bochatin, and I'm a general obstetrician gynecologist here in the Peoria area. I did my medical school training at Southern Illinois University School of Medicine, and that was between the years of 1992 and 1996. And then I did my residency here in Peoria at the University of Illinois College of Medicine between 96 and 2000. I've been in practice now 14 years. And so being from Southern Illinois University, or Southern Illinois in general, is not known for great medical care, meaning there's not a lot of physicians that go to that area. And so growing up on a farm, always delivering babies of some type or another, that's really the reason why I chose to go into obstetrics and gynecology. And being a woman, it just seemed natural that I would choose that profession.
When it comes to prenatal care, why do you think it's so important?
Well, prenatal care is important because it does help decrease the neonatal and infant mortality. Studies have shown over and over that the more prenatal care you get, the more consistent it is, the better mom and babies do. Well, definitely they do help predict or pick up birth defects. Granted, sonogram isn't perfect. It only picks up about 85 to 90% of those. But if we pick those up early, like a lot of times we can do things, like in your case, we picked it up so that the pediatrician could follow it long term so that it didn't become a lifelong or threatening condition. In other cases, like if we picked up heart defects, it could make a difference in that we determine where that baby's going to deliver. So they would deliver at a facility that could fix the heart defect. And you know, technology has gotten even so much better that now if we pick up things like spina bifida on ultrasound early, we can now do surgery on those babies while they're inside to help prevent long-term problems. So when I first started practice, we had babies who probably would never walk. Now that we can fix the defect inside the uterus, those babies actually have a chance to stand and bear weight. So prenatal care has come a long way. You know, sonogram, we have become so dependent on ultrasound. So, you know, we talked a little bit about the birth defects, but for me, sonogram is important for dating. Without a good dating ultrasound, a lot of times we're guessing what the due date is. And at least here in the U.S., you had mentioned some infant mortality rates, and it's 51 per 1,000 live births, I believe in Africa is what you quoted. Well, here in the United States, it's probably more like 5 per 1,000. And so most of our infant and neonatal mortality has to do with preterm delivery. And so not knowing what somebody's exact due date is can really increase that neonatal and infant mortality. For me, ultrasound is very important. The earlier I do an ultrasound, the more accurate it is. And so when people come in that have no prenatal care, that we don't know how far along they are, depending on what point in time that they present, meaning let's say they don't present until the 3rd trimester. Well, even then, their due date can be off by 3 weeks. And you know, we've come to the point, yeah, we definitely know that if they're below 36 weeks, that's probably not good. They're going to spend time in the hospital and have some health issues. But what about those babies that we call late preterm, the 34, 36 weeks? Those we're seeing some increased mortality as well, meaning we're seeing higher risk of ADHD and autism. And so for me, ultrasound is extremely important, more for dating. Yes, it's nice to pick up birth defects, but dating is probably more important. Plus, I use it to follow women who have other health issues, like if they have high blood pressure or diabetes. Part of our antenatal testing to see if baby is doing well is the ultrasound. And so we can check for size, we can check for fluid, and if there's an issue, we step in early before we do have a fetal death.